If I had to pick one spine diagnosis that I see every day, that I love to treat, but it's almost always missed or misunderstood, it's discogenic back pain. That's right, pain coming straight from your spinal discs, the very core of your spine's health. Most people with back pain don't even know this is the real cause, and worse, many get treatments that don't address it at all. Today, I'm going to show you the 3 most common reasons adults develop discogenic back pain, why it's so often overlooked, and how we can fix it for good, starting with what your doctor probably isn't telling you. Let's get to it. I'm Dr. Tammy Penhollow, a spine specialist and a regenerative medicine expert. Back pain is incredibly common, but the discogenic source is often misused, mistreated, missed. Today, I'm going to break down the 3 most common causes, explain why discogenic pain is misunderstood, and compare these traditional treatments with my signature Tower of Power program and what you can do for yourself and when to see a specialist. So let's start with the 3 most common causes of discogenic back pain. Number 1, degenerative disc disease. Think of the disc as like a joint. You get wear and tear of your elbow, you get wear and tear of your knees, that becomes degenerative joint disease, similar to the disc. The disc is basically kind of a water and collagen-filled substance that sits between the vertebra of the spine. With age, with wear and tear, a lot of twisting, a lot of load bearing, a lot of things that can happen, these discs can dehydrate. They can then get dried out. With that can come some weakening of the fibers on the outside, which kind of hold in a gelatinous shock-absorbing portion called the nucleus, and we can get degeneration of that. That can then lead to things such as a disc herniation. That's number 2. The outer layer and the inner layer kind of gets protrusion. And if we get protrusion even beyond that, where there's a rupture within this outer fibrous component, then the inner layer, the nucleus pulposus, can then come out into this area here where the spinal nerve rootlets live, into the epidural space, and that can actually kind of like dripping battery acid down onto the nerve rootlets. You can get symptoms down a specific nerve pattern, like down the butt into the hamstrings, across the inner part of your shin, or down the outside of your leg, the outside of the calf, into your great toe. It kind of determines what level the disc protrusion is occurring at. So that is number 1 and number 2. Number 3 is trauma or injury. Think, like me, you are out there doing a bunch of heavy landscaping and you decide that you and your spouse are going to lift this huge potted plant thing, and you feel some ripping, tearing, pulling as you do that. That is the trauma, or it can happen from some other high velocity event. So with that, we can get the rupture of the intervertebral disc. There can actually be a shearing force. You can get a tear of the annulus, or the fibrous portion, and that can also be very painful. So let's break that down even further. Say you've got the discogenic back pain that's coming from degeneration. What's the DIY, and when do you need to see a specialist? Let's break that down. So the DIY is pay attention to deep, persistent pain, especially worsen when you sit or when you bend. Normally, if you take a break, if it's due to arthritis of the back components, meaning the bony components, it feels better maybe to bend forward and take some of that pressure off of the spinal canal. But it may not feel so good if it's a discogenic pain, because you're actually weighting the disc, you're loading the disc, and you often cannot sit still. So simple posture awareness, avoid prolonged sitting, get up and move at certain times. Say every hour you set the clock for just a 5-minute stretch. You can lean over and stretch that lower back and bend. Don't just assume it's a muscle sprain if it lasts for a while. Early recognition is key so that we don't continue to get leakage out of that battery acid onto the spinal nerve rings. Specialist note, only a trained spine specialist can really identify and confirm discogenic pain, and we usually need very targeted exam and very targeted imaging. So if it's that, We need to also stay well hydrated. We need to maintain a healthy weight to decrease the load on that spine so that we're not continuously squishing out those discs. Maintain a habit where you quit smoking. The discs have very, very poor blood supply. And if you smoke, then that vasoconstricts or constricts the vessels that go to the discs. And that can lead to them getting not the nutrients, and they can wear and tear even faster. When we talk about the trauma or injury, use ergonomic chairs, ergonomic desk setups, do things smart when you lift, that you are bending from the knees and standing up, use lifting aids, strengthen supporting muscles through targeted exercises, having that strong tower of power or the core. That's including the muscles from the back of your skull all the way down to your sit bones and on the front where your abs are. So it's just not about doing sit-ups. That's not it at all. Take frequent stretch breaks, monitor and improve your posture consistently. When to see someone like me, this back pain is lasting greater than 6 weeks. You're just not getting relief when you're taking it easy a little bit. You're not completely bed rest. We don't do that anymore, but you get now symptoms, leg symptoms. You're getting some bladder or bowel changes. That's no joke. You go straight to the ER for that. Failure to improve with self-care. Why, if I'm saying this is so prevalent or whatever, is discogenic pain missed or mistreated? Well, it can mimic other things. It can mimic having a herniated disc or a pinched nerve from the changes of the spine from arthritis of the bony elements. The facet joints have gotten wear and tear, or you've got a muscle spasm because you've done some lifting, but it wasn't enough to rupture the disc. It wasn't enough to get a fissure within the annulus or the outer rim, but it's enough to make these muscles overlying be in big spasm, and that can mimic. So that's one thing. Number two, when we use treatments for such things, such as the muscles, or somebody does a MRI and the radiologist did not read that there was a disc tear, did not read that there was that fissure within the outer space, then the traditional pain doctor may say, well, I see that there's a little nub and a little herniation here that we want to just treat with an epidural steroid. And that's not going to treat the disc because it can't permeate the disc itself. It can't take out the issue within the disc itself. So if your treatment is only made worse or it doesn't get better, you're just getting maybe a reduction in pain, but you're actually not improving in your function. You're not getting stronger. You're not being able to sleep. You're not being able to go back to work or your workouts. It's time to seek a specialist. If we have these traditional treatments, let's talk about physical therapy. That's the most common thing. We want to stabilize the muscles back here. We want to stabilize the core. We want to make sure that your gait or the way you're walking is normal. That's one thing, but it doesn't treat the root cause. Oftentimes people take non-steroidal anti-inflammatories. They may take things like Tylenol. They may put salves on, such as CBD creams or Voltaren gels or some of those other things that cannot penetrate to the level of this disc. Say your back is out here, you've got to go through the skin, the fat, the muscles. You can't go through these bony elements to get to this disc. It's simply not going to reach that. If we go to the epidural aspect, again, even if that disc does herniate out and we're getting the inner contents of the disc, that dripping the battery acid down on these nerve rootlets, and we put steroid in this area to try to calm down the inflammation on the rootlets, that's not patching the tire. That's not stopping the leak at the disc. So you're not going to get the sustained relief that you want. If you do a surgery, say they do a microdiscectomy, even if it's minimally invasive through these teeny weeny little holes, and they go and they shave off the portion of the disc that has bulged, that doesn't fix, again, the discogenic pain, meaning that there's still that fissure, there's still that leakage, there's still that issue where the tire is going to have this slow leak, and then we're going to get to a space where we've got truly bone on bone of our vertebral bodies. Then we're going to have more constant issues with the nerve rootlets not being happy. So many of these treatments are not specifically addressing the disc. You need to address the disc if it's discogenic pain. Otherwise, you're just treating the neighbors. So stay away from NSAIDs short term. We've actually found that it can stop the body's own healing cascade, and you can get an incomplete response to an acute injury, or the acute injury response takes much longer to heal. So things like Tylenol at a regular dose, as long as you don't have liver disease, can maybe be better. Things like topical, things like heat and targeted stretching and engaging in good physical therapy that has been set for you because they know your other constraints, such as a bad shoulder or a bad hip or a bad knee. They've watched you walk. They want to change your gait in a good way. So we need to be patient. We need to be realistic. Most back pain gets better on its own, but when it does not, that's when regenerative orthobiologics, like I do with platelet-rich plasma or bone marrow aspirate concentrate into the disc and the neighbors, may be the right way. I take great pride in letting you know that one of the late great leaders in this field, Dr. Gregory Lutz, wrote a patient-facing book on this called Heal Your Disc, End Your Pain. And when we do not address the disc, we simply don't get the kind of response that we need to. I've taken all of this into a organized and highly personalized system called Tower of Power. We want to know your story. What was the original injury? What is the back history of all the other things that have occurred over time? What are some other joints that may be affected? Say you've got a bad knee, you're changing the way you walk, that translates all the way up the spine with the alignment, with the maybe asymmetric or uneven wear and tear. Therefore, we are more likely to see some things that need to be fixed to include that entire kinetic chain all the way from the foot to the back. We have limits with our own DIY. I tried to DIY my own discogenic back pain. Believe me, I've looked at all these things that we've talked about before, except I did not do steroids because I do not believe that steroids had any role in this. And at some point, I knew that we needed to get to the root cause, which was the discs themselves. So it would entail tightening the core, everything in this cylinder. So cut off my arms, cut off my legs, cut off my heads. What you're left with is the cylinder. That is the Tower of Power. We need to strengthen that. I use M-Sculpt because it's above and beyond what any of us, you or I, even if we're perfect, even if we paid the best trainer in the entire world, it's perfect 20,000 contractions in a 30-minute session for the abs, for the lumbar spine, sometimes a thoracic spine, for the glutes, and oftentimes for the quads or the hamstrings, depending on what else is going on. We need to make this rock solid. If these muscles are weak, then these spinal segments are not stable. If these spinal segments are not stable, uneven wear and tear, bending, twisting, flexing, on extenuating circumstances where there's weakness, you're going to get more discogenic pain. So we strengthen the core. We anti-inflame you from the inside out. It is a personalized approach to your diet, your nutrition. We want to make sure that we are in a building phase, increase protein. We are optimizing your gut microbiome because that is very, very anti-inflammatory. We are making sure your vitamin D levels, your anti-inflammatory markers in your blood are normal, that we've got no abnormalities of the blood glucose monitoring system. So if A1C is high, we've got to bring it down before we use your own cells. We get all these together, we get you strong, we reduce the inflammation in your blood for platelet-rich plasma or in your bone marrow for bone marrow aspirate concentrate. It comes from this area. Then we very skillfully, with fluoroscopy guidance, put those cells into the disc themselves. It's as simple as that. It is done under sedation. It is done so you are comfortable. It is done safely. We reduce risk of infection of the disc with our absolute sterile technique using 2 needles, needle through the needle, with a surgical prep, completely gloved, gowned, etc. Some IV antibiotics, a little bit of intradiscal antibiotic to reduce the risk of an infection in the disc. And we also treat the entire unit. It's not just the discs that have a problem. They're the root, but what's outside this root? We've got the epidural space. That gets treated. We've got the facet joints. Those get treated. We've got the overlying muscles and ligaments. Those get treated. The sacroiliac joints are always involved because who's the joint below the spine? The sacroiliac joint. All this in a personalized program that helps you get back to the activities you love. So, when can you not DIY this? Numbness, weakness, drop foot. You are getting atrophy, like one quad muscle this big and one quad muscle this big. That's a big deal. That nerve root needs to be decompressed because with the nerve root go the blood vessels, and you need to go to the emergency room if you're having loss of bowel, bladder, or erectile function. Otherwise, if you are interested in learning more about this and the DIY hasn't worked for you, like, subscribe. I'll have other tips on when to get extra help, deep dives on the shoulder, on the knee, on the hip, on the elbows, and other joint pain topics. I'd love to see you in the office for a Tower of Power to discuss how we might get to the bottom of your discogenic pain.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.